my name is Christy. I'm going to be your nurse today. Just going to wash my hands and put some gloves on here, and then we'll get started. Give us some privacy. Can you tell me your name and date of birth?
Cheyenne Milbrandt, 8/20/91.
Great. I'm just going to verify that on your wristband. Perfect. So we're going to be doing a head-to-toe assessment today. Is that all right with you?
Yes.
Okay, great. So first, I just have to ask you a few questions. Can you tell me where we are today?
The hospital.
Great. And what day of the week is it?
Thursday.
And what are we doing today?
A head-to-toe assessment.
Perfect. So just looking at Cheyenne, she is calm and content. She's not using any mobility aids or sensory aids that I see, and she is not on supplemental oxygen. I'm going to get her vitals. I would get blood pressure, pulse, respirations, temperature, O2 saturation, and pain level. Are you in any pain today?
No.
Okay, great. And so moving on, starting with the head, it is proportionate to her body size. I'm going to just palpate here. Let me know if you have any pain or discomfort with this. No pain?
No pain.
Good. So there are no masses or deformities felt. I'm just going to look through the hair here. And there are no infestations or alopecia noted. Good. Looking at the face, it is symmetrical. There doesn't seem to be any swelling or suspicious lesions. First, I'm going to have you close your eyes real tight for me, and then open them, and smile, and frown, and puff out your cheeks. Great. So that facial cranial nerve number 7 is intact. And next, I'm going to feel on some sinuses. Let me know if you have any pain. First, your maxillary. Any pain?
No.
And frontal. No pain there?
No pain.
I'm going to feel on your masseter. Just clench your teeth for me. Great. And then I'm going to feel on your temporal mandibular joint. Open and close your mouth. Great. No clicking or grating, and that trigeminal nerve is intact. Let's see. Moving on to the eyes. Looking at the eyes, they are symmetrical. The sclera is white. I'm going to have you look up for me. I'm going to pull down. Conjunctiva is pink and moist. Pupils are about a 4 normally. I'm going to test their constriction. Go ahead and just focus on something on the wall there for me. Okay, the other side. Great. And so they restrict bilaterally to about a 3. And then next I'm going to test some eye movement. So I want you to follow my pen for me and try not to move your head. Great. There were no involuntary shaking or movements of the eyes. The last test with that, I just want you to look at my pen and alternate your vision to the wall and then go back and forth. Good. Accommodation is active. So pupils are equal, round, reactive to light, and accommodation. Good there. And cranial nerves 3, 4, and 6 are intact. Next, looking at the nose, have you been having any drainage or discomfort there?
No.
Okay, good. Just going to look into the nares. There's no obstructions or redness noted there. Good. I'm going to test your olfactory nerve here. I'll have you close your eyes for me and tell me what you smell.
Oranges.
Perfect. So that olfactory nerve is intact. Moving down to the mouth, the lips look pink and healthy, no suspicious lesions. I'll have you open your mouth for me. I'm going to look inside. The oral mucosa is moist and pink, and everything is intact. There are no suspicious lesions. Can you stick out your tongue for me and move it side to side? Great. And then one more time, stick out your tongue and say ah. Ah. Great. So the uvula raised, and it is midline. So that cranial nerves 9, 10, and 12 are intact there. Any difficulty swallowing?
Mm-mm.
Okay, good. And let's see, moving on to the ears here. Any drainage or discomfort?
Nope.
Okay, I'm going to feel on your pinna and percuss the mastoid process. Great. I'm going to look in here by pulling the pinna up and back. No redness or foreign objects, and tympanic membrane is pearly gray. And the other side here. Just feeling on the pinna, mastoid process. And we're gonna look inside. And again, no redness, foreign objects, and tympanic membrane is pearly gray. I'm gonna have you plug one ear for me. I'm gonna say a set of words and you tell me what I say.
Okay. 1, 2, 3.
Great, and then plug that side for me.
Apple, banana.
Perfect, so that vestibulocochlear nerve is intact. Let's see, next I'm gonna feel on some lymph nodes. Let me know if you have any pain or discomfort.
Okay.
First is pre-auricular, post-auricular, occipital, parotid, tonsillar, submandibular, submental, and moving down the cervical, supraclavicular, infraclavicular. No pain or discomfort?
No.
Great. And there were no masses or deformities felt. I'm going to have you look up for me. I'm just going to examine the trachea. It is midline. There does not seem to be any masses or deformities there. And then look down. And then I'll have you look to that side. Great. And now I'm looking for jugular vein distension, and it is not noted. And then that way for me. And again, no jugular vein distension there. I'll have you shrug your shoulders. Great. So that cranial nerve 11 accessory is intact. I'm going to feel on the carotid pulse, just one side at a time. Great. It is regular and equal on both sides. Next, I'm going to listen to some lung sounds. So I'll just have you take a deep breath every time I touch you with my stethoscope, okay? Inhale and exhale.
Sorry, I'm not a good breather.
Great. Breath sounds were regular and unlabored. And next I'm going to listen posteriorly. I'll just have you lean forward just a little bit. And again, take a deep breath every time I touch you with my stethoscope. Good. Breath sounds sound normal and regular. There did not know any wheezing or crackles or stridor. They were unlabored. So just looking at her anterior posterior diameter, it looks proportionate. I don't notice any barrel chest. One more time, take a deep breath for me. Great. Chest expansion is equal bilaterally. Next, I'm going to listen to some heart sounds. Second intercostal space for the aortic, pulmonic, Erb's point, tricuspid valve, mitral valve. Great. Heart rate is normal and regular. Now I'm going to listen with the bell. Great. I did not auscultate any murmurs there. Let's see. Next, we are going to move on to the upper extremities. So just looking at her skin, I'd like to note that it is warm, dry, and intact. I'm going to test range of motion here. Any pain or discomfort with that?
No.
Great. Just moving. Testing skin turgor. And she is well hydrated. Just this side. Again, no pain or discomfort there.
No pain.
Great. Okay, I'm gonna feel radial pulses bilaterally. They're strong, regular, and equal, and brachial. Again, strong, regular, and equal. I'm gonna test capillary refill, and it is less than 2 seconds. Any numbness or tingling in the fingers?
No.
Okay, great. For this next part, I'm gonna have you lay down in the bed. Okay, are you experiencing any abdominal pain or discomfort?
No.
When was your last bowel movement?
Yesterday.
And was it normal?
Yes.
Okay, great. Any difficulties with urination?
No.
And when was your last menstrual period?
It ended Friday.
Okay, and was that normal? Okay, great. So next I'm just gonna take a look at your belly here. I'm not seeing any scars or wounds. The skin is warm, dry, and intact. Any history of abdominal surgery or trauma?
No.
Okay, great. So next I'm gonna take a listen to some bowel sounds. Starting in the right lower quadrant. Bowel sounds are active and normal in all 4 quadrants. Next, I'm just going to palpate. Let me know if you have any pain or discomfort with this. You okay?
No.
Good. So the abdomen is non-distended and it is not concave. There doesn't appear to be any bladder distension and she's not having any pain. Bowel sounds are normal. So that is good there. I'm going to move on down to the legs here. Just looking at them, they appear, skin color is good. They are warm, dry, skin is intact. I'm going to press on the shin bone here. There's no edema present. We're going to test range of motion. Any pain or discomfort with these movements?
No.
Okay, good. I'm going to palpate the popliteal pulse bilaterally. It is strong, normal, and equal. And posterior tibialis. Again, it is regular and equal bilaterally, and the dorsalis pedis. Regular and equal bilaterally. I'm going to have you pull up on your feet for me. Great. And push back. Perfect. Range of motion is good. Muscle strength is normal. This next part, I'm going to have you stand up so I can examine your backside. Perfect. So just feeling, starting at the vertebral prominence, we're going to go down the spine here. I'm not noting any abnormal curvature of the spine. There are no pressure, ulcers. Definitely check the back of the heels. Other than that, no suspicious lesions. Everything looks good. And I'm going to test your balance and gait. I'm going to have you walk heel to toe, just a few steps forward and backwards for me.
Okay.
Great. And then just close your eyes and just stand there with your arms. I'm just going to watch you. And there's no swaying, so balance and gait is good. I think that concludes the head to toe. So I'll have you down, and there's your call light. Please let me know if you need anything. Thank you.